Good morning to everyone on the West Coast and good afternoon to our friends on the East Coast. I'm Dr. Sam Joaquim, Chief Dental Officer for Zufall Health Center, and I welcome you to today's webinar. Before we begin, a few housekeeping items. Participants will enter the session on mute to avoid any background noise during the presentation. Today's webinar will be broken down into a 50-minute presentation by our guest speaker, followed by a 10-minute question-and-answer period from the chat, moderated by our Chief IT Officer, Brian Wang. Please feel free to chat in your questions during the presentation. Questions that are not addressed during the session will receive a response directly to the email account associated with that question. If time allows, we will also take a few live questions at the end. You can raise your hand at that time to ask your question and you will be unmuted. Today's session is being recorded and a link to the video as well as the slides will be sent out to participants next week. CE credit is only available for those who attend the live stream and remain connected for at least 45 minutes. Viewing the recording only does not qualify for credit. You will receive a SurveyMonkey link following today's session. It will pop up automatically once the webinar is done, so please stay logged on and don't close the webinar window on your screen. Please complete the survey to receive your CE certificate if you are requesting dental credit. Make sure to enter your name as you want it to appear on the CE letter with complete words and capital letters where applicable. CE certificates will be sent out the week of May 25th. Zufall will be offering a series of CE webinars over the next few weeks, and you are invited to attend. Next slide, please. Support for this Zufall webinar series is provided by the Horizon Foundation of New Jersey. Next slide, please. Before I turn it over to our guest speaker, I would like to share a couple of slides about why this topic is so important to us in the dental community. Dental professionals are well aware that smoking leads to many dental problems, including bad breath, tooth discoloration, inflammation of the salivary gland openings on the roof of the mouth, increased buildup of plaque and tartar on the teeth. Smoking also interferes with the normal function of gum tissue cells and impairs blood flow to the gums, which affects wound healing and makes smokers more susceptible to infections, such as periodontal disease, which could lead to bone loss in the area surrounding the teeth. Smoking also delays healing following tooth extraction, periodontal treatment, and oral surgery. It is associated with lower success rates of dental implant procedures. Next slide, please. Nicotinic stomatitis is an asymptomatic lesion associated with heavy pipe or cigar smoking or from exposure to extreme heat from drinking hot liquid. It typically appears as a keratotic covering of the hard palate with numerous small, slightly raised macules with centrally located red dots. It appears after a patient finishes smoking, and there's a slight potential for malignant transformation. Leukoplakia is 6 times more common among smokers than non-smokers. Leukoplakia is defined as white plaque of unknown origin that cannot be scraped off and cannot be attributed to another definable lesion. It can be seen secondary to trauma and repeated friction, where it would not be of concern. However, when a biopsy is taken, 6% of purely white lesions are found to be cancer or precancerous. Next slide, please. Cancer typically presents as a mass or non-healing ulcer. They are hard, large, and indurated to the touch and fixed in place with restrictive movement. According to the American Cancer Society, most lesions, about 75%, are related to the use of tobacco and alcohol, but some, especially in the back of the mouth and the pharynx, are related to exposure to the human papilloma virus, HPV subtype 16. We are pleased to be joined today by our guest speaker, Cathy Butler Witt. Cathy is the Assistant Director of Public Health Programs at the Southern New Jersey Perinatal Cooperative and Family Health Initiatives. For 19 years, she has focused on tobacco and electronic nicotine delivery system cessation, education, training, and implementation of treatment and policy for providers in New Jersey. She is a seasoned trainer on the new generation of tobacco addiction vaping and the CDC's evidence-based best practice brief intervention model, Ask, Advise, and Refer, which she'll be covering today. Cathy holds a master's degree in human services, a bachelor's degree in social work, and a national certificate in tobacco treatment practice. Cathy has trained our staff, including the Children's Oral Health Program staff, who in turn go out to the community and into schools to teach people about the dangers of smoking and tobacco and the relationship to oral health. I turn it over now to Cathy.
Thank you very much, and good afternoon, everyone. Again, my name is Cathy Butler Witt. I am bringing this presentation to you via a grant from the New Jersey Department of Health. The first thing I want to do is just show 2 slides with information regarding COVID-19 and the relationship between smoking and vaping. The World Health Organization states that smokers are more likely to become vulnerable to COVID-19. And one of the reasons is because when a person is smoking, the act of taking their hand from their cigarette to their mouth, that transmission of the virus from hand to mouth can occur. Smokers may also already have lung disease or reduced lung capacity, which greatly increases the likelihood of serious illness. Conditions that increase oxygen needs or reduce the ability of the body to use it properly will put patients at a higher risk of serious lung conditions such as pneumonia. In addition, in April of 2020, the CDC lists smoking, as you can see here circled on the infographic, as a condition of immunocompromised. And what this illustration is showing us is that this is in a long list of other conditions that a person may increase their risk for COVID-19. This infographic is available on the CDC's website. So we're going to move forward to the presentation, Ask, Advise, Refer. First, let's talk a little bit about the impact of nicotine. Smokers become addicted to nicotine, which is a drug that is actually found naturally in the tobacco leaf. More people in the United States are addicted to nicotine than any other drug. Research suggests that nicotine may be as addictive as heroin, cocaine, or alcohol. Quitting smoking is very hard and does require several attempts to quit. Typically, it takes 8 to 10 quit attempts in a smoker's lifetime to be quit for good. People who stop smoking often start again because of withdrawal symptoms, stress, and weight gain. The Ask, Advise, Refer process helps a person have lower relapse rates and increased rates of cessation. So let's look a little bit about smoking in 2019, what our rates are looking at. Nationally, our rate is about 14%, and in New Jersey, our rate is a little lower at 13.7%. For pregnant women specifically, we're about 4%, and high school students, we're about 5%. And this picture is a graph showing us the decline in smoking rates from 2011 to 2017. The blue is US rates and the red is New Jersey rates. And you can see here they're following the same trend and they are slightly lower than the national rate. This chart is our county health rankings and we go from 2011 to 2019. Our total New Jersey rates are in the bottom in red, and you can see that in 2011 on the left-hand side, our smoking rate as a whole state was 17%. And we took a nice dip from 2011 to 2017 down to 14%. But as you can see, looking at 2018 and 2019, we are still as a state at 14%. So our movement has literally plateaued. The other thing on this chart is that we've listed every county individually. From 2017 to 2018, you can see our colors in our green and red. Our green color is that we've decreased, our red color is that we've increased. What's very unique, from 2018 to 2019, we had no changes at all. again, thinking about our plateau. So this is just showing us why in New Jersey this is still very important that we need to work with people who are smoking. And we do say that right now, because our numbers are relatively low, we really are working with people who are very heavily addicted to nicotine and having struggles quitting. So the clinician impact, what does this all mean? What guidelines do we follow? We follow the clinical practice guidelines from the Department of Health and Human Services. And we haven't had an update since 2008, which really is good because that means the practices that we're following are working and they're evidence-based. So I just took a couple snippets from the guideline. The first one is tobacco dependence is really a chronic illness that often requires repeated intervention and multiple attempts to quit. Effective treatments exist that can significantly increase the rate of long-term abstinence. So again, decreasing those relapse rates and increases the probability of someone quitting. Clinicians should encourage every patient willing to make a quit attempt to use counseling treatments and medication recommended by the guideline. And brief tobacco dependence treatment is effective. Clinicians should offer every patient who uses tobacco at least the brief treatment shown to be effective in the guideline, which again is the 5 A's is the gold standard. That takes somewhere around 10 minutes. And Ask, Advise, Refer is the approved shortened version, which takes about 3 minutes. And why this is so important, where do we look at for our data? So this data, again, is from that 2008 update. And what this is showing us from the left part of this graph over to the right part of the graph, healthcare providers and physicians or clinicians have a direct impact in an intervention with helping that person quit and stay quit. So we're going to get into the model now, Ask, Advise, Refer, and it seems very simple. Ask, right? We know how to ask a question, give some advice about the hazards of smoking, and then refer to some resources. And what the basis of this intervention and the way that this works is that we are saying to clinicians, we want you to use this process every single time you see a patient, every time, even if you are repeating the question several times. Even if someone has indicated that they're a non-smoker at a previous visit, you want to continue to ask that question because as I said earlier, it takes so many times to be quit for good. We want to make sure that if someone indicates they're a non-smoker, that perhaps they haven't relapsed or started. So first, what we want to do is spend 1 minute approximately asking about tobacco use. Most of us are using electronic medical records right now for tracking our tobacco use with our patients. And most of those electronic medical records are an indicator of a black and white yes or no. Do you smoke? Yes or no. Are you a smoker? Yes or no. The process of this ask is to take that black and white away, that yes or no away, make the question a little bit bigger so we can capture those people that don't fit into that yes or no, that we want to think about, are they a previous smoker? Think about, are they vaping? Think about if they have exposure in their home. And that way we can elongate the conversation to help us get those folks that we know are still smoking to be able to feel comfortable having that conversation with us. So ask about the type and the amount of tobacco used. Instead of, are you a smoker? Think about saying, explain your use of tobacco in any form. Most of the time, patients are coming to you for a particular reason that they don't think has anything to do with their smoking. They're not intending to come to your office to talk about smoking. So we need to make them feel comfortable when asking these questions and make sure that they can answer in a fashion that gives you the correct information. Tell me about your tobacco use. So again, not black and white, not yes or no. Describe your tobacco use in the past. Now again, folks that have never smoked or are currently not smoking, they might think this is a little funny thing to be asking them, explain your use of tobacco in any form, but you'll get those folks that really are no's, that are not using, say to you, I don't use tobacco in any form, right? So again, yes or no. What we need to be cautious of is those folks that are sitting in your office during this intervention that are smokers, that are not ready to talk about their smoking. So this might be a little uncomfortable for them, but you're still going to get those folks that are going to answer no or not any, no, not any use of tobacco at all, even though they might be a tobacco user, as indicated as other things such as an odor from tobacco, maybe discoloration of their fingers or of their teeth. But we are going to always have those people, and we need to continue to give them that advice, even if they indicate that they're a non-smoker. If the smoker is identified as a current smoker, you want to elongate that conversation. You want to continue this ask. How many cigarettes per day do you smoke? How many cigars per day do you smoke? How often do you puff on your e-cigarette? Think about evaluating their nicotine dependence. So now you have someone who sent to you, yes, I am a smoker. Keep that conversation going so you can get them to the point where you're giving them some concrete advice and you're giving them a referral to a cessation resource. Ask them about barriers to quitting. Maybe they've tried to quit before, they haven't been successful, so they continue to smoke. Determine their readiness to enroll in some kind of cessation program. Do they want help to change this? Some smokers really just want to keep smoking. We still need to give them that advice, but other smokers probably don't want to smoke and don't know where to turn to. As a matter of fact, statistics tell us approximately 70% of smokers right now want to quit and don't know how. Discuss previous attempts, what worked, what didn't work, how might you be able to help them, maybe have a conversation about nicotine replacement therapy. For the client who quit using smoking, congratulate that person. That's a big deal. It's very, very hard to quit smoking, and it's hard to stay smoke-free. Make sure you follow up with relapse prevention information. Talk to them about different programs that are available. Encourage them to remain smoke-free and to reach out for help if they're craving or if they have a relapse. And then we want to move into advice. You want to make sure the advice is clear, strong, and personalized. So in other words, we don't want to say you shouldn't smoke, or it's dangerous to smoke, or you're hurting your health or your dental health because you're smoking. Really want to use a non-judgmental advice. For example, my best advice for you and your family is to quit smoking. And then we want to make it even stronger than that. As your clinician, I need you to know that quitting smoking is the most important decision you can make to protect your own health. Personalize it for that patient. Use your patient's name. If you know your patient has children in the home, talk about their children. If you know your patient has perhaps some other illnesses, talk about that relationship between that. For example, this person that we're going to give you the scripting for, we're saying has COPD. So while you are here about your COPD, I need you to know that secondhand smoke affects the health of your family. This person happened to have a family, this clinician knew that, so they elongated that conversation just to make sure that that smoker is thinking about other indicators. Employ that teachable moment. The provider should emphasize the importance of quitting before health problems arise or get worse. The impact of current health or illnesses status of the patient. So if somebody already has an illness, continue to talk about the relationship between their smoking and vaping and that illness. Perhaps right now there aren't any indicators that this person has other illnesses due to their smoking. Maybe we want to talk about the probability or the cost in health regarding smoking. Impact on children and other in the home. So second and third hand smoke, what is that doing to their environment? And then costs associated with smoking, about how much does it cost for a pack and how much are they using? And then also on their own health. And then some facts that we want you to use, which we're really going to dive into a little bit later on the presentation, but you can tell your patients it does take 6 to 10 quit attempts in their lifetime to be quit for good. There are those that, decide that they're going to make a quit date, that they're going to go cold turkey, they're not going to use an intervention, and sure enough, for years that person doesn't smoke. That is really true, and that happens. But the majority of smokers do require an intervention. A lot use nicotine replacement therapy, and there are many that do relapse, come in and out of that quit. Tell them about the 7,000 chemicals that are in every single cigarette. Let them know if they have children or they're pregnant that it triples the risks of SIDS in infants. And then give them some education about second and third hand smoke. So for example, as your doctor, I must advise you to stop smoking now. Whether or not you want to quit, I really can help you. Let me give you the phone number for Mom's Quit Connection or the New Jersey Quit Line. You can receive free counseling on how to quit and remain tobacco free. I know that quitting smoking is very difficult. Even people who do not want to quit are successful. Sometimes it takes more than one try. I know you can do it. Let me refer you to Mom's Quit Connection or the New Jersey Quit Line. And here's some examples. You will be getting this PowerPoint later, so we did provide examples to some specific patients as the pregnant mother, youth that you're working with, and again, different samples for hospitalized heart attack, cancer patients, and parents of children. And then we want to think about, where do we refer? So we have 3 free services here in the state of New Jersey: Mom's Quit Connection for families, the New Jersey Quit Line, and the New Jersey Quit Centers. And later on in the presentation, we're going to dive deep into how to refer to these programs. So just as an example, New Jersey has free services to help you quit smoking: Mom's Quit Connection for families, the New Jersey Quit Line, and local quit centers. Using support services can more than double your chances of quitting. So this is just a graphic, a slide of these free resources. So the New Jersey Quit Line, it's a free telephone-based counseling for New Jersey residents. There's a toll-free number. There's a website that people can go and click to enroll. Also, as clinicians, you can use our email or electronic health record auto-refer, and we'll get into that later. Mom's Quit Connection for families, Quit for kids. This is a face-to-face program in Southern New Jersey, and it is a phone counseling in Central and Northern New Jersey. This is very specific for individuals who are pregnant or have families with children 7 and younger. Again, there's a toll-free line. We now have a texting support program called Quit for Kids, and also there's a website and Facebook for auto-enroll. New Jersey Quit Centers, we have 11 quit centers in our state across 12 counties, and at this website you can find which one is closest to your center that you can refer your clients to. So this is kind of a summary of what we just went through, the ask, advise, refer model. So again, have you ever smoked or used any form of tobacco in the past month? Not, do you smoke, are you a smoker? Opening up that questioning, opening up the conversation, making the patient feel comfortable admitting that they are using a product. If you have the no's, that takes the right, in advice, that takes the right block there. Have you ever smoked or used tobacco before? And following that path, if you have a no, again, you congratulate the patient. If you have a yes on a previous smoker, congratulate that patient. They have quit and they are quit now, but provide them relapse prevention materials. And then back up to the top, have you ever smoked or used any form of tobacco in the past month? Your yes folks, the best thing you can do for your health is to quit tobacco. Are you planning to quit in the next month? Your no folks, provide educational handouts and encourage quitting. Make sure we repeat this process at the next visit. Your yes folks, provide a referral to the Quit Line or Mom's Quit Connection. Discuss medication to support cessation if appropriate. So let's talk a little bit about nicotine addiction, how that happens in our body. So cigarette smoke is a deadly mix of more than 7,000 chemicals. Hundreds are toxic, over 70 cause cancer. Every cigarette manufactured here in the United States has approximately 2 milligrams of nicotine per cigarette. Very important number for you to know if you're going to work with nicotine replacement therapy. Once a person, an adult, has smoked approximately 100 cigarettes in their lifetime, they become addicted. Nicotine receptors develop in the smoker's brain, and they stay there, and they are dose and time sensitive. So the more a person smokes, the longer they smoke, the more those receptors are there, and the more difficult it is for that person to quit. There are 3 components to this addiction: physical, habitual, and psychological. So physical is a physical craving for that tobacco, and withdrawal symptoms happen in the abstinence of using that. Habitual, the use is ritualistic and done without thought at all. For example, where they buy their cigarettes, what brand they smoke, how they light them with a match or a lighter. It's always the same over and over again. The first one in the morning, is it right when they're still sitting in their bed? Is it with their first cup of coffee outside on their porch? The same all the time. And psychological, the belief the user can't function without this habit. You know, they can't have their coffee without it. They can't work on their computer without it. They can't visit with a particular person without it. And unless all three of these components are treated, the person's risk for relapse is higher. So this is just a picture of what happens starting on the left-hand side. So we breathe in our cigarette smoke, all 7,000 of those chemicals. The nicotine actually peels itself off of the rest of the chemicals and travels up to our brain between 7 and 10 seconds. That rapid delivery of the nicotine happens very quickly. That nicotine creates a level of buzz. Those endorphins feel really good, and that smoker gets that, nice feeling. So smokers truly believe that smoking is a relaxant and not a stimulant. And about every 2 hours, then that nicotine starts to deplete and deplete and deplete, and the withdrawal symptoms happen. And that is following these pictures from the left to the right. And once that nicotine is depleted, then what happens is that body starts to crave, that body starts to go through withdrawal. And this is just a picture of when that nicotine peels off from all those other 7,000 chemicals. The nicotine enters that brain, the stimulation of the receptors occur, and that dopamine is released. And again, that's that moment, that nice, soft relaxation. And really what that is that's taking away the withdrawal symptoms that they were previously feeling. This is just a picture of the nicotine replacement therapies and prescriptions that are available. So both prescription and over-the-counter is on this chart. Again, you will be getting this. So this really describes all of the programs. This also gives you all the precautions, any side effects, and costs associated with this. So this is what this is withdrawal symptoms, recovery symptoms. When that 2 hours is over, and that's an approximate window, person starts to get a craving for that cigarette. They can feel dizzy. They can get some headaches and coughing, have a lot of trouble concentrating, irritability, fatigue, and constipation. And this is not the full list, but this is a partial list for you to look at. So what we tell our clients when we work with them is that your body might feel a certain way, not feel so good when you quit smoking, but look at this great thing that happens really within minutes and hours of your body stopping smoking. And this chart is available. You'll get it on your PowerPoint. And if you want it individually, I can direct you where to find it. But this is a real great graphic for people who are quitting. Why am I quitting? What's happening in my body? Is it all worth it? And in fact, this tells us 15 years out of quitting, heart attack risk is the same for someone who has never smoked before. So what are some of the health effects associated with tobacco use? Smoking harms nearly every organ of the body, causing many diseases and reducing the health of smokers in general. So what happens is, we talked about that nicotine gets peeled off, goes up to the brain gets satisfied. But what happens with all those 6,999 other chemicals? And what happens is those chemicals go down into the person's airway, they travel down into their lungs. From their lungs, they cross over to the red blood cell. And that red blood cell sitting in the heart, just gathering the oxygen and the nutrients that the body needs. And these chemicals are stronger than the good chemicals, the oxygen and the nutrients. They actually deplete the good chemicals, adhere themselves. So when that red blood cell leaves the body and travels in our vascular system, it delivers all of those chemicals from head to toe into our body. And that's how all these chemicals and all these cancer-causing agents get down all the way down to our feet and into our hands. They cause poor circulation. Oftentimes smokers have very cold feet, toes, hands, fingers, discoloration in their toes and fingers, and that's all a result of these chemicals traveling in our vascular system. More deaths are caused each year by tobacco than all deaths combined from HIV, illegal drug use, alcohol use, motor vehicle injuries, fires, suicides, and murders combined. So this is a list, and I'm not going to read this, but I think this slide is very telling, and certainly this isn't even everything, but the impact of smoking. We have here our list of cancers on our left-hand side, and I do give this list because if you read down those lists, you can clearly see that this is not an illness that is just lung cancer. These are many, many cancers throughout our whole body. We have pulmonary diseases, COPD, pneumonia, acute pneumonia. People who are smoking, as we said earlier, with COVID are more susceptible to these breathing illnesses. And then to the right-hand side are cardiovascular illnesses and certainly other effects. The other thing I wanted to call to your attention is that when a person is smoking, oftentimes these chemicals create an interference with medications that patient may be on. Tobacco smoke can interact with and inhibit the effectiveness of certain medication. Cars and cigarette smoke affect the rate at which the liver metabolizes certain medication, causing blood levels of antidepressants, for example, and antipsychotics to decline. Some people may need a dose adjustment when quitting or reducing smoking when resuming smoking following abstinence. Nicotine replacement therapy over the counter does not interfere with antidepressants or antipsychotics. I do want to talk a little bit about smoking and mental health because about half of our annual deaths from smoking are with people who do have mental illnesses or substance abuse disorders. This is definitely a comorbidity that we need to look out for. The most common cause of death among people with mental health disorders are heart disease, cancers, lung disease, which all can linked to smoking. Using a combination of motivational approaches, cognitive behavioral therapy, nicotine replacement medication results in quit rates comparable to those you see in the general population. Some research suggests that tobacco treatment may be most effective when folded into other mental health care. So let's talk about secondhand smoke. Secondhand smoke is the combination of smoke from the burning end of the cigarette and the smoke breathed out by the smoker. Secondhand smoke contains about 7,000 chemicals, and over 70 are cancer-causing chemicals. Now we want to remember that the smoker themselves is when they are breathing out that cigarette smoke, and that plume of air might be around other people, but it's also around that smoker. So when a person lights up, they are constantly being exposed to these chemicals, even if they're not pulling on the end of the cigarette, because they are right in front of that secondhand smoke. There is no safe amount of secondhand smoke. The U.S. Surgeon General's report that in 2006 and in 2010 stated that secondhand smoke is a Class A carcinogen with no safe level of exposure. Secondhand smoke risks among non-smoking adults. Non-smokers who are exposed to secondhand smoke at home or at the workplace are an increased risk of developing lung cancers, coronary heart disease, and respiratory problems. 41,000 non-smokers die every year from exposure to tobacco smoke. Secondhand smoke and children. About 4 out of 10 US children between the ages of 3 and 11 are exposed to secondhand smoke. 56% of New Jersey students between 9th and 12th grade are non-smokers exposed to secondhand smoke. 8 to 13% of asthma cases in children under 15 years are attributed to secondhand smoke. The increase in frequency and episodes and severity of symptoms of asthma are attributed to secondhand smoke. 200,000 to 1 million asthmatic children are affected by secondhand smoke annually. Possible problems with cognitive functioning and behavioral development with children are associated to the chemicals in secondhand smoke. And also these children are more likely to become smokers themselves. They're also more likely to suffer from ear infections, bronchitis, and pneumonia. Third-hand smoke is actually all of those chemicals that are landing on porous materials from that secondhand smoke. So once we can't see that plume of smoke anymore, what happens to those chemicals? Some dissipate into the air, but many do not. They land on porous materials, soft substances, soft surfaces, people's hair, their skin, their clothes, but also on chairs and also in cars, in the fabric, in carpet. Drywall actually absorbs those toxins. If you are in a room of a person who smoked and they have a light colored wall, if you take a picture off of that wall, you can actually see the outline of that picture of the tars that were sucked into that drywall. Also in a car, if you have someone who's a smoker in a car and you take a white damp paper towel and run it all the way at the end of the dashboard where the front window attaches, and run it all the way across that dashboard and take a look at it, you will have a yellow paper towel at the end of it. Those are all those chemicals that are still active and toxic. Through third-hand smoke, people can be exposed to those toxins found in secondhand smoke. So even though we don't see them, they are still active. So that means a person who smokes and lives in a smoking environment is constantly taking in those toxins. There's never a break in that person's body without those toxins. Low level of toxins can build up to dangerous levels in the body, and this can cause learning problems for children. Third-hand smoke can stay on unwashed surfaces for days, weeks, even months at a time. For example, we've worked with smokers. They started their quit attempt perhaps in the spring. They've taken their winter coats and their sweaters and they've put them back in their closets away for the season. And come the following fall, when they pull those clothes out of their closet, they can still smell that cigarette smoke on those clothes. So we really always want to encourage a smoke-free environment. So as you're using Ask, Advise, Refer, even if your patient doesn't want to make a change in their smoking consumption, or they're trying to make a change and they still haven't quit yet, you really want to ask them to always go outside, not just open a window, not just open a window in the car when they're driving, to completely live in smoke-free environments for both themselves and their family. That way the smoker, when they're not smoking, they're not being exposed. And then, of course, their family members don't have that exposure. Secondhand smoke causes nearly 34,000 premature deaths from heart disease each year in the United States among non-smokers. A smoke-free environment decreases health risks associated with environmental tobacco smoke. Scientific evidence indicates that there is no risk-free level of secondhand smoke. I'm going to take a couple of minutes and talk about nicotine delivery, electronic nicotine delivery systems. They're also considered e-cigarettes, vape pens, hookah pens, tanks, mods, Juuls, etc. All of them are battery-powered heating devices. They were originally designed to deliver liquid nicotine to users in the form of an aerosol. The aerosol comes from heating this liquid nicotine and the flavoring. So some facts that you should know is that this is not an FDA-approved cessation device. Labeling on these products are often inaccurate, and nicotine content is not consistent. This is a vapor, it is not water. This vapor is not water, it is an aerosol. Although the e-cigarette vapor does not contain 7,000 chemicals that are found in a cigarette smoke, the vapor can contain toxins, metals, and ultrafine particulates. 99% of these products contain nicotine. They also contain flavoring, which the manufacturers will tell you qualifies as generally recognized as safe by the FDA. And that might be the case for food and food additives, but not for inhalation. The effects of many of these inhaled flavorings are still largely unknown, and we have seen an uptick in lung inflammation disease like popcorn lung. This slide is about e-cigarette or vaping product use associated lung injury, or EVALI. Right now, the hospitalized cases as of the end of February are no longer being counted because of COVID. But up until the end of February, we had 27 hospitalized cases. All 50 states had the cases. We've had 60 deaths in 27 states. And our symptoms: cough, shortness of breath, chest pain, nausea, vomiting or diarrhea, fatigue, fever, or weight loss. In all of these cases, some vape product was being used. We have seen vitamin E acetate and black market cannabis in some of the users. The users inhale the oil-like substance that might coat their lungs. And other concerns: it is linked to seizures, cardiovascular disease, and depression. So who is using this and who's at the highest risk? Who's this new generation of tobacco addiction with these products? And definitely this is our youth. In 2019, more than 1/3 of high school e-cigarette users now report using 20 or more days a month, while 18% of middle school users report using such frequent use. 64% of high school students who use an e-cigarette reported using mint or menthol flavor, and this goes to our flavorings that again is not recognized for safe to inhale, and that's a 13% increase from 2018. So as I said earlier in the presentation, I really want to drill down into these free services that are available when you do refer your patients for cessation. So the first program I want to talk about is called Mom's Quick Connection for Families. Mom's Quick Connection has been in the state of New Jersey for 19 years. They are housed at the Southern New Jersey Perinatal Cooperative. It is a free, unlimited smoking cessation program. We offer face-to-face counseling in the Southern region, and right now we are doing that virtually. We offer telephone counseling in Northern and Central New Jersey, and we have a texting support and educational self-help materials. Again, women who are pregnant or mothers, as well as caregivers of children 7 years old and younger, are qualified for this service. The person does not need to be ready to quit. So Mom's Quick Connection is a little unique in that we have unlimited services, and it's one-on-one, individual instead of group, and a person can come in before they're ready to choose a quit date to start doing behavior modification and really learn about their triggers. Registration, counseling services are available Monday through Friday, 8:30 to 5. There's a fax referral from a provider, and that's our fax number. We can have verbal consent on that form. Also, an email referral from the provider can be sent to this email address, and verbal consent is available as well. The self-referral is through that toll-free number. We also have a website referral and a Facebook referral. This is a picture of our Fax to Quit referral form, which my office can prepare for you, and the top can be filled out already and send it to you electronically so it's available on your computer when you're ready to refer. The provider, again, fills out the top part, unless we've done that already for you. The bottom part where it says consent gets filled out by the provider or the participant. Again, verbal consent, it's down towards the bottom. There's a little box where you can check off. And you can see at the bottom left-hand side of this referral, again, the person does not have to be ready to quit to join the program. The benefit of using this fax form, whether you send it through fax or whether you send it through email, is that you do get a status form back as to what happened with that referral. The only way to get this status form back is to use the document on the previous slide. Quit for Kids texting support program is brand new. We just launched this approximately 2 weeks ago. And again, this is the same target audience of Mom's Quick Connection. The services are at no cost at all. There's an automatic set of personalized messages that go out to a person once they complete the enrollment, cessation and relapse prevention, as well as facts about triggers and urge management, stress management, healthy lifestyle, and eating habits all are on this program. Online Facebook registration is available. You can text the keyword Quit for Kids to the number provided. And we also automatically refer all of the clients that come into Mom's Quick Connection to this service. This is just a graphic of what the flowchart looks like for Mom's Quick Connection. So Mom's Quick Connection counselors try multiple times to get in touch with clients that have been sent in from their provider. We have a minimum reach of 2 attempts, but we try many more times because we want everybody to come into service. At the very least, if you refer a client, just know that there are many attempts. You will get a recorded attempt on that status form, and at the very minimum, they receive self-help materials in the mail. The New Jersey Quit Line, it's a free telephone counseling for residents of New Jersey. They really must be ready to quit because they get 2 quick coach calls for one particular quit attempt. And these are their hours. They are open 7 days a week. They get 3 attempts per year, and that year starts on their very first attempt, so it's not a calendar year. There's also 2 free weeks of nicotine patches for qualified callers. So what happens with that person when they call in or when you refer them in? So if you look on the left-hand side of this rainbow graphic, the tobacco user comes into the program. The first call is an assessment and planning. The second call is the quit date and follow-up, and then as they become tobacco-free. We also have email support, web coaches, a quick guide, 2 free weeks of that nicotine replacement therapy, and they also get a 7-month follow-up as well. Also, New Jersey residents also get English or Spanish in a portal and web enrollment, mobile response. They can chat with a coach on their mobile phone, and they can opt into the email support program. And your referral options. So you as a provider, again, you can use a fax, you can use email or an electronic health record to auto-refer from your provider. Both of those are verbal consent. You can simply give the toll-free number and a person can refer themselves from the website. This is a picture of the fax form for New Jersey Quit Line. And again, in my office, we do fill this out the top for you. We register you into our database. We send these back to you already filled in, so you can just store them on your computer. Again, the feedback form for the New Jersey Quit Line, you can get real-time feedback, what happened to that patient that you've referred into the program, and then that way you can record that into their health record and have that point of conversation for the next time they come in and see you. The New Jersey Quit Centers, so all the gray counties unfortunately are not covered by those quit centers that I talked about. All the other colored counties are covered. And the way that you find out where the closest quit center is to you is tobaccofreenj.com. This again is a free service. They are still seeing clients virtually and they try to do group. They also have free nicotine replacement therapy as well. Again, there's 11 quit centers. They cover 12 counties. They do individual and group counseling. They provide residents with resources to stop or reduce their use of tobacco products. And they do, if they qualify, they will get free nicotine replacement therapy. In addition to the resources, there are always special projects from Tobacco Free for Healthy New Jersey. And right now we are having Protect Your Children Against Secondhand Smoke and Aerosol Exposure for Tobacco Free Ride NJ, Clean Air for Kids in Cars. This is a program that's available to every single driver in the state of New Jersey. And it's a matter of taking a pledge and stating if somebody in your car is 18 and younger, you're not going to smoke. So you can do this whether you're a smoker or not. And the first 500 pledges that we receive, we actually send a smoke-free quit package that has different gifts for you in that to help you maintain a clean car. And then we also have Tobacco Free for Healthy New Jersey provider materials. And on the left, the picture is talking about how Medicaid New Jersey Family Care covers over-the-counter nicotine replacement therapies. However, for that patient to get that free therapy, they do have to have a prescription from their provider in order to give the pharmacist and get the pharmacist up and running in their account. And then on the right-hand side, we have a brand new smoking cessation provider toolkit, which is inclusive of all the materials that I'm talking about. There is the fax referrals in there. There's billing codes in there for services, and that is for free. And both of these resources you can find on NewJerseyQuitLine.org. So in summary, clinicians really have an impact on our smoking rates here in the state of New Jersey. Tobacco addiction is a chronic disease and deserves ongoing clinical treatment. Effective smoking cessation can reduce illness and improve patient quality of life. Every time, ask your patients if they use tobacco, advise them to quit, refer them to resources that are available. And these are some credible online resources that we want to share with you. These are live links, so when you get this PowerPoint, you should have them at your fingertips. And I always usually end with this cartoon because what's interesting is it was written in 2000. And she's saying, do you realize that drugstores make sick people walk all the way to the back for their prescriptions, but healthy ones can buy the cigarettes right in the front? And the unfortunate part about 20 years later is there's only one pharmacy chain here in the state that has decided not to sell tobacco products, and that is CVS. So this still is valid even 20 years later. Thank you very much.
All right, thank you, Cathy. If there are any questions, please go ahead and type it into the chat or drop it in the question and answer.
Yeah, that was fantastic, Cathy. I want to ask you while we wait for questions to come in, or I see actually one coming in. Oh, go ahead, Brian. I'm sorry.
No, you can go ahead. How long does it take to average smoker to quit?
How long does it take? Unfortunately, there isn't an exact number. It really depends on that person's motivation to quit, that person's history of quitting before, any barriers, any successes, and if they're using nicotine replacement therapy, and how much and how long they've been smoking. What I can state is that most smokers, when they quit, they feel the symptoms that I talked about, usually for about 2 weeks. They are controlled by nicotine replacement therapy, but that's about the process, 2 weeks from there. But it can take a person a long time to quit, and also multiple attempts.
Now the questions are rolling in. What is your success rate?
So I actually, the success rate I can talk about is Mom's Quit Connection for Families, because that is operated out of our office. For our pregnant women, we have over an 80% success rate in quitting. And for our non-pregnant participants, we have approximately a 30% success rate in quitting. I don't have the QuitLine success rates right in front of me, but I can get them, and then I can give them to Dr. Rakim, and he can send them out.
Are there other programs in other states similar to this in New Jersey?
So there is a national QuitLine. It is, you'll have to look it up. It's a Quit Now number. I don't know if it's 800 or 866, but the last, it's Quit Now. So if you just Google Quit Now, National QuitLine, yes. And there are actually many states that do have cessation resources. Where I refer people from other states is definitely the first shop that you could go to is your state Department of Health. Most of the time they'll have them listed there. The other thing is there are many hospital systems, including some in New Jersey, that do have free or low cost smoking cessation programs through their lung cancer programs that they have.
Next question. If you observe that a patient is smoking marijuana, would you ask and advise with that patient too?
I absolutely would ask, advise, refer if they're using marijuana. Any substance that they're taking into their body that's burning or heated, you can use this ask, advise, refer method. Absolutely.
That was great because we are fighting the COVID-19 virus now. You mentioned smoking increases the risk of contacting virus. Is it because of the contact from hand to mouth, or is it because of something else?
It is the hand to mouth, right? So if you go back to that, I think it was this first slide, it's the World Health Organization. Once you get these slides and look at that, yes, the World Health Organization is saying that, so the person stores their packs of cigarettes, you know, in their pocket or on their desk or on their dashboard or, you know, in their purse, what have you. Their hands have been wherever during the day, and they are constantly reaching for that pack of cigarettes. Then they're taking that same hand and reaching for the actual cigarettes, and then taking that same hand while they hold the cigarette and bringing it up to their lips. So we have to think about that, right? COVID, one of the big things they're saying to us is wash your hands, wash your hands, wash your hands. And in between each step of lighting a cigarette, if a person hasn't washed their hands, there is an increased risk of transmission.
Does age play a role in ease of quitting?
No, not necessarily. I have people that have smoked for 25, 30 years. For example, when smoke-free housing was going on in the state of New Jersey for residents, a lot of the residents were older that were living in multi-home dwellings, and it was really hard for them. But we had one person in particular that was really kind of disgruntled that you know, they had to quit within a year's time because of going to a non-smoking environment. And then when we visited back that facility, sure enough, that person quit and was actually very appreciative of us coming and helping them. So no, age does not matter. We do have, with length of time of smoking and how much a person is smoking, there is a relationship between how difficult it is to quit smoking, because those nicotine receptors do multiply. So if I have somebody who is a new smoker, regardless of age, smoke for a short period of time, smoke less than a pack of cigarettes versus somebody who smoked over a pack of cigarettes for a very long period of time, those two people will have a very different picture in their quit attempt.
All right, I believe those are all the questions. I want to apologize if there were some technical difficulties with sound. It is very difficult to control the internet capabilities of our speakers, as well as Zoom, as well as our attendees. But the presentation has been recorded, and Dr. Joaquim will be able to get that to people who had difficulty hearing. Thank you.
Yes, and thank you again so much, Cathy, for another very informative presentation. I will remind the attendees to please complete the SurveyMonkey link following today's session. Please stay logged on and complete the survey to receive your CE certificate if you are seeking dental CE credit. The certificates for today's webinar will be sent out the week of May 25th. 2 more webinars will be scheduled this month at Zufall as part of this webinar series sponsored by the Horizon Foundation for New Jersey. Flyers for those programs will be sent out early next week. I hope you could join us again at that time. For additional questions or information about today's presentation or future programs, please feel free to contact me at swakim@zufallhealth.org. Be well, stay safe, and enjoy the rest of your day.